Which inhalational anesthetic has a blood gas partition coefficient closest to that of nitrous oxide? Options are isoflurane, desflurane, sevoflurane, or halothane. Answer is option B, desflurane. During administration of epidural anesthesia, which anatomical structure is least likely to be penetrated by the needle? Options are arachnoid mater, ligamentum flavum, supraspinous ligament, or interspinous ligament. Answer is option A, arachnoid mater. A 7-year-old child with short stature presents with hypopigmented skin lesions and cognitive impairment. Laboratory evaluation reveals a defect in DNA repair involving double-strand breaks. What is the most likely diagnosis? Options are Bloom syndrome, xeroderma pigmentosum, Cockayne syndrome, or Lynch syndrome. Answer is option A, Bloom syndrome. Deficiency of which vitamin is associated with the development of follicular hyperkeratosis? Options are vitamin A, vitamin C, vitamin E, or vitamin B6. Answer is option A, vitamin A. A defendant is considered legally exempt from criminal responsibility if, due to mental illness at the time of the offense, they did not understand the nature of their actions or that those actions were wrong. This principle is called. Options are irresistible impulse test, McNaughton's rule, Curran's rule, or Durham's rule. Answer is option B, McNaughton rule. Which of the following poisonings can lead to acute liver failure? Options are belladonna poisoning, Amanita phalloides poisoning, morphine poisoning, or organophosphate poisoning. Answer is option B, Amanita phalloides poisoning. A 50-year-old man presents with unilateral serous otitis media along with a history of cervical lymphadenopathy. What is the most likely diagnosis? Options are angiofibroma, nasopharyngeal carcinoma, adenoid hypertrophy, or tonsillar abscess. Answer is option B, nasopharyngeal carcinoma. A chronic alcoholic presents with a pruritic eczematous rash over the neck and the dorsum of the hands. Which nutritional deficiency is most likely responsible? Options are vitamin B3, vitamin B1, vitamin D, or vitamin C. Answer is option A, vitamin B3. Which of the following substances plays a key role in hepatic conjugation reactions? Options are hyaluronic acid, glucuronic acid, gluconic acid, or glycolic acid. Answer is option B, glucuronic acid. Which extraocular muscle is innervated by the abducens nerve? Options are lateral rectus, medial rectus, superior oblique, or inferior oblique. Answer is option A, lateral rectus. Which of the following is associated with the least risk of trial of labor after cesarean? Options are classical C-section, breech presentation, low segment transverse incision, or preeclampsia. Answer is option C, low segment transverse incision. A 25-year-old woman in her first trimester is being screened for blood type compatibility. The doctor explains that some antibodies are less concerning in pregnancy. Which of the following antibodies does not cause ABO incompatibility? Options are immunoglobulin M, immunoglobulin D, immunoglobulin G, or immunoglobulin A. Answer is option B, immunoglobulin D. A patient with high blood pressure is taking thiazide diuretics and reports fatigue along with low potassium levels. Which of the following medications can help reduce potassium loss? Options are acetozolamide, amiloride, furosemide, or indapamide. Answer is option B, amiloride. A 11-year-old girl is rushed to the emergency department after a bee sting. Minutes later, she develops shock, respiratory distress, and circulatory collapse. Which type of hypersensitivity reaction is most likely causing these symptoms? Options are T-cell mediated response, immunoglobulin E mediated reaction, immunoglobulin G mediated reaction, or immunoglobulin A mediated hypersensitivity. Answer is option B, immunoglobulin E mediated reaction. Optic nerve gliomas are most commonly associated with which of the following conditions? Options are schwannoma, neurofibromatosis type 1, tuberous sclerosis, or neurofibromatosis type 2. Answer is option B, neurofibromatosis type 1. A patient is involved in a road traffic accident and suffers fractures of both the tibia and fibula. What type of fracture is most likely? Options are depressed skull fracture, bumper fracture, cervical fracture, or patella sleeve fracture. Answer is option B, bumper fracture. A 32-year-old patient reports blurred vision, sensitivity to light, and mild eye pain. Eye examination shows keratic precipitates and aqueous flare in the anterior chamber. What is the most likely diagnosis? Options are iridocyclitis, posterior uveitis, toxoplasma uveitis, or intermediate uveitis. Answer is option A, iridocyclitis. A 6-month-old male infant presents with chronic diarrhea, failure to thrive, and repeated bacterial and fungal infections. Genetic testing reveals an autosomal recessive form of severe combined immunodeficiency. Which enzyme deficiency is the most likely cause? Options are phosphomannose isomerase, ornithine transcarbamylase, hypoxanthine guanine, or adenosine deaminase. Answer is option D, adenosine deaminase. An 8-year-old child with a history of generalized tonic-clonic seizures presents with convulsions lasting more than 45 minutes. What is the most appropriate management? Options are levetiracetam followed by valproate, lorazepam followed by levetiracetam, carbamazepine followed by lorazepam, or valproate followed by gabapentin. Answer is option B, lorazepam followed by levetiracetam. Which hormone primarily acts on the endometrium after ovulation? Options are follicle stimulating hormone, progesterone, estrogen, or luteinizing hormone. Answer is option B, progesterone.